Ever heard the one about the doctor who told his patient, "I have good news and bad news. The good news is that you are not a hypochondriac." Well, it's a good day when you find out you're not obsessively worried about your health, isn't it? But let's take a step back, way back to the days when healthcare was less about hypochondria and more about, well, survival. Back in the 18th century, America saw the establishment of its very first hospital. Now imagine this, folks. Your local doctor was likely also the barber, the dentist, and maybe even the local butcher. Talk about a one-stop shop. And you know what they say? An apple a day keeps the doctor away. But back then, it was probably more like, an apple a day keeps the barber, dentist, and butcher away. So while we're glad you're not a hypochondriac, let's journey through the history of healthcare in America. If you thought the 18th century was a wild time for healthcare, just wait until you hear about the 19th and 20th centuries. We kicked off the 19th century with the first recorded successful surgery under anesthesia. That's right, folks. Our brave ancestors finally said goodbye to biting bullets and hello to a dreamland while their bodies were being fixed up. Then, in the mid-19th century, we saw the advent of germ theory, which fundamentally changed our understanding of disease. No more blaming bad air or evil spirits. Instead, we had a new culprit: tiny, invisible germs. As we moved into the 20th century, healthcare started to look a bit more like what we know today. Hospitals transformed from grim places of last resort to centers of scientific advancement. The introduction of antibiotics in the 1930s was a game changer. Suddenly, infections that were once death sentences could be treated with a simple pill. Meanwhile, the two world wars, as devastating as they were, had a silver lining. They spurred a slew of medical advancements, from blood transfusions to plastic surgery. Then, in the second half of the 20th century, we started to see the rise of health insurance. Before this, getting sick could mean financial ruin. But with the introduction of employer-sponsored insurance and later, government programs like Medicare and Medicaid, healthcare became more accessible. But it wasn't all smooth sailing. As healthcare advanced, it also became more complex and expensive. This led to a whole host of challenges that we're still grappling with today. So from the first anesthetized surgery, through germ theory, antibiotics, and health insurance to the high-tech, high-cost system we know today, the evolution of healthcare has been a roller coaster ride. We've made incredible strides, but we've also faced and continue to face significant hurdles. But let's not forget, we started with doctors who thought bloodletting was a good idea. So, from leeches to lasers, healthcare has certainly come a long way. Fast forward to the 21st century, where we have more medical advancements than you can shake a thermometer at. Imagine a world where you can access a doctor at any time, no matter where you are, through a device you carry in your pocket. Welcome to the era of telemedicine, my friends. With the advent of the internet and smartphones, we've seen a seismic shift in healthcare delivery. We now have virtual consultations, electronic health records, and remote patient monitoring. It's like having a doctor's office in the palm of your hand, minus the cold stethoscope. But let's not forget about the Affordable Care Act, also known as Obamacare. Say what you will about the politics, but this legislation expanded health insurance to millions of Americans who previously couldn't afford it. It's like a buy one, get one free deal, but for health insurance instead of shoes. Now let's take a peek into the crystal ball. What does the future hold for healthcare in America? Well, if you've ever seen a sci-fi movie, you might not be too far off. We're talking artificial intelligence and personalized medicine. Imagine a world where a tiny robot can diagnose and treat diseases, or where every treatment plan is tailored to your unique genetic makeup. Sounds like something out of a Star Trek episode, right? But wait, there's more. The future of healthcare also holds promise for greater emphasis on preventative care, mental health, and holistic wellness. We're moving away from the traditional model of treating illnesses and towards a model focused on maintaining overall health. So what's the takeaway here? Basically, healthcare has come a long way from the days of leeches and bloodletting. We've seen tremendous progress and innovation, and there's still so much more to come. And that's a wrap on our journey through the history of healthcare in America. From humble beginnings to high-tech advancements, it's been quite the ride.